Uh, Good evening to all of you, and it's a warm good evening to all of you, rather each one of you. Today marks a significant moment as we embark. It's our first live session, which focusing on a vital aspect of our Ayurveda course, and that is basically the fundamentals of child psychology. And as a fellow student of Ayurveda, let us all comment by delving into the foundational essence of this field. When we specifically look at this field, that is that Ayurveda, a term, basically this is a term which derived from Sanskrit. And when we said it derives from Sanskrit, it means it has its own profound meaning. It means that it is somewhere the science of life. And very interestingly, when we talk about the life, it means we are talking about a child, because a child has the life, right? And Ayurveda basically is a sort of a discipline. It's a very interesting one, where the holistic system, no doubt there is a holistic system of medicine, there is a holistic system of well-being, which somehow encompasses a deep understanding of life in all its aspects. It means it somehow touches all the aspects of life. It also recognizes that life is an intricate balance, and the main idea of the life is to develop a sort of an intricate balance of various elements, not only of various elements, rather various energies and various systems. There are so many systems, like the energies and elements which we're supposed to put together, and within the human body as well. So that is the main essence of Ayurveda. Ayurveda means somehow it is an overall idea that the holistic system, where everything should be at place. The life should be at the center, the science should be at the center, and somehow it is also known as a system of medicine, and which supposed to focus, on so many elements, which supposed to focus on the energies, which supposed to focus on the human body simultaneously. So the aim of Ayurveda, definitely we can say, and after going through that course, you might agreed upon, because we all are an Ayurveda student, that the aim of an Ayurveda is to achieve that harmony, to achieve that balance among these elements, among all these things, that energy, the human body, as well as the system and the medicines, to achieve a sort of a balance among these elements, which can promote the optimal health and vitality. And that is the main aim of Ayurveda. And especially because we're supposed to talk about our course, that is that's the fundamental of child psychology. So when we shift, because we started our discussion with the with the basic meaning of Ayurveda, that is science of life. And when we shift our focus to the child, and when we just want to talk about the child, we somehow encounter the embodiment of life in its the purest and the most vibrant form. When we said the purest and the most vibrant form, it means the real essence of the child. And when here I'm talking about its most purest and the most vibrant forms, it means, as I said, that the child is representing, and child is representing what? The child is representing the essence of the possibilities. The child is here representing the essence of the growth. The child is here representing the essence of the innocence, that makes us to be, that makes us to feel that life. And this symbolizes the perpetuation of life. These all are the symbolic representation. When I said that child as an essence of possibility, it means what I'm doing, what we are doing, we are just trying to symbolize certain things. We are trying to see the possibility in terms of child. When I said that the child symbolizes growth, it means what? It means that we are symbolizing the growth. That is a symbolic form, right? And symbolically, we are trying to say that the growth is somehow related within a child. And when we said that somehow the innocence, it means what? Innocence, it means what? That we are trying to symbolizing that innocence in terms of a child as well here. So within the realm, and within the realm of this Ayurveda, very beautifully, the child's connection to the life is emphasized in such a manner, like through which, the child's journey encompasses not only the physical health, that our idea is not only focusing on the physical health, but also their emotions, the psychological and the spiritual well-being. I mean, everything is important and everything just covered under the realm of this Ayurveda. We just can't say that when I'm talking about Ayurveda, so it means like my, that the whole idea is to focus on the physical health. No, it's not that. We just can't stop ourselves there. Like if I'm talking about that, like Ayurveda, it means it's an umbrella term. Like our emphasis should not only within a physical health, right? It should, I guess, our focus should also be on the mental health. Our focus should also be on the psychological aspect and the spiritual well-being of a child. So Ayurveda have that potential to recognize this somehow, that the child's holistic development is crucial, and the focus should be on the overall development of the child. And definitely their earlier experiences, whatever they are having, is equally important. And I still remember my guru, my teacher always said that never ever in the class a child alone, a lonely entering. No, not at all. When a child is coming inside the classroom or wherever the child is coming, and suppose, just imagine a situation that I'm a Ayurveda practitioner and a child just supposed to come to visit me, then the child is not coming alone over there. Rather, the child is entering there with so much of an experience, with the whole context and with rich experiences, and those experiences somehow that greatly influence their lifelong well-being. So that's what makes, that the Ayurveda a very important subject to all of us. And especially when we talk about the Ayurveda, this course, the fundamental of child psychology, which we already, because we have gone through so much of, the sessions, we might have gone through the complete course as well by that time. And somehow I do feel that we all realizing the importance, and we all realizes that what makes this subject enriched by this, that added effect of the child psychology. So also, I just want to take our focus to the, that initial discussion, then by relating the child with the life, because I started my discussion with a very interesting term that, when the science of life, that's what the Ayurveda means. So it means somehow what I'm doing or what we are doing here, we are trying to relate the child with the life. And when we are relating it, right, so what we are trying to do, we are trying to acknowledge the child's inherent vitality. And of course, no doubt, we are also trying to acknowledge the potential for the growth, not only the potential for growth, rather the transformation, and there is a big difference between the change and the transformation. What is the difference? I know that you can't respond, but even then, it's a rhetoric question. I want to respond this, that when we talk about the change can go in any direction. It can either be the positive or the negative. But when we talk about the transformation always have a positive direction. So when we just relate it with, the child with the life, and while talking about the Ayurveda in between, then it means what we are doing. We are trying to acknowledge the child's inherent vitality, whatever they do have already, right? As well as they have a certain potential for growth, because the child is living in a context. And in one of our session, we talked about the context. And I guess in the very first class, we talk about the perspective development. So with that context, with that potential for the growth and transformation, we can very effectively, somehow relate the idea of the child with life. And we understand, definitely, because we are in the medical field and we are the future practitioners. So we do understand that their well-being extends beyond the physical realm. We can't delimit it to the physical realm. We can't say that there is a physical arena and we just want to delimit it. No, it's not possible. And while I'm saying that it's not delimiting, we can't delimit it. It means what we are doing, we are encompassing the emotional resilience. We are also encompassing or trying to cover about, the cognitive developments, and especially that spiritual growth as well. That also comes under the part of an Ayurveda. So as an Ayurveda practitioner, we have a unique opportunity to delve into the complexity of the child's life, as well as to contribute to their overall well-being. And especially, and I must say that no one else can do that better than us, because we do have that scope. Being an Ayurveda practitioner, we have, that umbrella, that ambit through which that our focus is not only on the, the physical aspects, rather the overall development of the child, and especially the mental, the cognitive, the spiritual, and the overall, that when we talk about the overall, it means that we should not leave a single aspect, undeveloped or untouched. So moreover, the child's life is intricately connected to their what? To their immediate family, the very first thing. We also discussed in one of our sessions regarding that, where we are talking about the spheres, like what are the context of the child. When we just talked about that, then there we shared that how the child's life is somehow directly related with the family, and definitely the community, because community also plays an important role, and society as a whole. And when we study the child, then we gain a sort of insight. Insight into what? Insight into the effective ways, which can support very effectively the healthcare professionals. Healthcare professionals, when I'm talking about the healthcare professional, it means somehow we are like putting us as well at the center. So we got an insight to study the effective ways to support the healthcare professionals in doing what? In creating, in nurturing the environment. We are creating one side and we are nurturing the environment that fosters the child's holistic growth and well-being. So it gives them a huge scope to go through it. And somehow, we can say that Ayurveda, as in a science of life, provide us with a profound understanding of the interconnectedness of all the aspects of life. And what we usually do, we recognize the child's unique need, because every individual is different. Every individual have their own, that on their requirements, they have their own specific needs, as well as their potential. We are also recognizing the potential and the challenges, which we very well understand via this course specifically. And I'm sure that you all must agree what I'm saying, right? Because by that time, I'm assuming that we might have covered the half of our course, because the exam is like supposed to, we're supposed to go through the exams as well. So I'm expecting that by that time that we all are on the same page, and we all are agreeing that, with this course, we got in a sort of a potential through which we get a better insight to recognize the child's unique need. Also to look at the potentials and the challenges, which I believe that after knowing that, we can contribute to their well-being. And also through which we can shape a future. We can shape the future of our children that somehow cherishes and supports the growth of every child. So, and also, I came to know that there are the numerous courses. It's not the only course. There are so many other courses also, which we studied in our Ayurveda, which covers all the therapies and the practices to treat the patient. And especially, I still remember, I was just like going through some of the session. I came to know that how, with the help of some sort of simulated practices, you get acquaint yourself to treat a patient, right? For the mental and the physical health. Right, there are the physical challenges and the mental challenges. So there are the therapies, there are the treatments for both the things. And of course, this particular fundamentals of child psychology course is unique in itself. And if I'm using the word unique, I'm specifically using the word unique. Why I'm using it? Because it's not now. Rather, since the time immemorial, we all trust that Ayurveda helps in preventing and the curing any kind of illness by eliminating their root cause. And it's very important. The important focus is on elimination, the root cause. It means to get into the basics, to get into the, the genesis of the, of that particular, that illness or disease. And of course, when we try to put the content, and especially when we were working on this, we covered, in this course, we found that the child psychology plays a very important role to develop that understanding that help to cure or heal oneself. because here we need to know the individual differences, here we need to know the potentials, here we need to know the context, here we need to know the specific requirements of each and every child. And because like it takes time to cure, so without knowing the individual, without knowing the child, it will not be possible at all to cure at the own pace, because every individual has its own pace. So somehow we can say that justified psychology is one of the many branches of psychology and very important for the Ayurveda practitioner, and especially that's how it became important for all of us. And this particular branch focuses on the mind, as well as not only mind, rather it also focuses on the behavior of the children from what? From prenatal development through adolescence. And in one of the session, if you remember, we discussed like the child development in term of like purvkalik or garbhadharan, or like prenatal, postnatal stages. And there was one session in which we talked about all these things in detail. So I must say that now, like by that time, we came to know that while going through these videos, and when you were like going through this course, that child psychology deals not only with how children grow physically, but it also seeks to better understand their mental development, their emotional development, and social development as well. So it covers the whole area. And of course, when I'm talking about the mental aspects, and when I'm talking about emotional aspects, so it will not be complete without talking about the contemporary situation, the 21st century, this current situation. And in this competitive era, as we all know that we are living in a competitive era, the mental illness in the child is more prevalent than any other disease, rather diabetes, the leukemia, or any other disease. And especially there was one report, there was one study like through which I came to know that even in the USA, like so many students are like, they have some sort of a mental disorder than any of the other childhood illness. It means somehow it is a very growing field. And when we talk about the mental disorders, the child illness, or like some sort of the depression, the anxiety, the frustration, to get into it, it is very much necessary to know the child and its whole aspect. The children like were feeling comfortable, when we compare, like why I'm talking about the current situation or the contemporary situation is because like the children, I mean, like the ancient time, they were very much comfortable like in the concept of the joint family, because the joint family, they were like very much the prevalent, and mostly there were the joint families. And as the child is nurtured by one of the persons in the family, so they meet the child needs, and a child will become comfortable because that was a joint family. And like somebody, not the X person, rather Y or Z person, might be very much in sort of the contact, and they understand the requirement of the child very well. But what is happening now? As the time passes, right, the psychological disturbances in the adults, it increases. And what is happening with that increased stress, like their mental status is changing every day. And the mental status, that changed in such a way that they can't adjust. They can't adjust with the other family members. And that was the main reason. That's why the joint families are turning into the nuclear families. So now what is the food for thought for us? For us, like as an practitioners, as an Ayurveda person, it is like important that the psychological status of the parents we need to study, the psychological status of the children we need to know, because nowadays the psychological status of the parents are also not in equilibrium, and they are running for what? And they are running behind the name, they are running behind the fame, they are running behind the money, and etc. And in that race, somehow they neglect the child's all-round development. And especially when we talk about the psychological development, sometimes, I mean, when I had in a discussion, then people thought that it is not a part of a growth and development. Let's keep the part of growth and development different from the psychological development. But it's not like that. When we talk about the psychological development, it is very much a part of a growth and development, which is being forgotten by many parents. Nowadays, like, it's very common, like, the parents are giving emphasis to the physical growth of the child, but somehow the psychological development, like, gets neglected. But we can't neglect it, because it is very, very, very important. And the child is nowadays alone in the family. And being in alone, what is happening? They are looked after by the workers, they are looked after by the ayahs, and does not get its zone of comfort, which was there in the earlier days, which is there when we are living in the joint families. So this kind of a mental or the emotional conflict is exhibited by the child in the different form. Like, what is happening nowadays, like, the child is having so much of the traits, the personality traits, in terms of they're crying a lot, the, like, sort of a fear, the purposeful like mutism, and they're not able to mingle themselves very easily. They're not gelling up well, lack of concentration, and the hyperactivity, and so on. So these are the symptoms which is like, which we observe usually when we talk about the psychological aspect of the child nowadays. And like, Ayurvedic medicines, definitely, when we talk about the psychological aspect of the child, they just proved to have the capabilities to improve the mental abilities, and to process, to develop a cure for the mental disease, definitely. But Ayurveda provides the best choice for a mental and the psychological disorder through the various formulation in the Panchkarmas therapy. But there are the Panchkarma therapies, but for the effectiveness of those therapies, it is central to understand the fundamentals of child psychology. And in this way, somehow I strongly believe that with the help of this, and by that time, we has marked its significance. Now, let's come to the main discourse, like, of our today's discussion, and to give a brief overview and or the outlook, I divided my discussion in the four important sections. Like, four important section, I just like made this division on the basis of our course, because our course is actually in this way. The very first is like, we are going to talk a bit roughly, though there are like so many videos in those sections, but we will talk about which areas we covered in this paper. Right, it's a sort of a revision for all of us. So because we already covered like the important 5 areas, so we will talk in a brief about those areas. Secondly, we will also talk about like the major context in the child psychology, which we covered in our paper, or which we are covering in this course. Thirdly, because we are the practitioners, and as a practitioners, how to understand this course, what are the lens we need to use to understand this course of child psychology. And at last, I just want to discuss that like how it is important for all of us, and how we need to look at it with a futuristic perspective, right? So we will cover mainly, or we will discuss these 4 important aspects in today's discussion, or in today's talk, right? So as I mentioned earlier, that like, we will talk about the major areas like the covered in this course, within the child psychology course. So mainly, we divided our course, right, in the 5 aspects. If it could have not have been live session, then I might have asked the question to you, because that is the question to be responded by you. But let me answer this question. In our course, there are like the 5 important sections. That one is the development aspect. Another, there are the milestones, which we discussed. The third are like behavioral aspect. The fourth, like emotional aspects. And the fifth, the socialization, where we try to put the sanskars in between, the solar sanskars. And also we try to see that how that the sanskars are the part of that socialization. So in that way, we covered our syllabus. Now, let's go with the very first area, that is the development, right? Mainly, when we talk about development, there are the 3 important areas of child development. And we also discuss the perspective of the developmental aspects, right? Where we talk about the behaviorist perspective, the cognitivist perspective, the constructivist perspective, and all. So there we talked about the perspective as well as the child development. So when we talk about the 3 areas of child development, and with the varied perspective, it means what? We majorly focus on the physical development. We also focused on the cognitive or intellectual development. And third, that is the social and the emotional development. We clubbed it. I clubbed it actually for a revision sort of thing, right? So when we talk about the physical development, we discussed like how the physical development is directly related to the the physical bodily changes. So, and we also discussed that how it is related, that comparatively, the relatively stable, the predictable sequences. We also talked about the difference between the growth and development. Also, it includes the acquisition of certain skills, such as the gross motor and the fine motor coordination. So, these are the things which majorly we covered while talking about the physical development as well. We also try to look at it with the different perspectives. It's not that with a single lens, because we can't see the whole world with a one frame. We need to change our lenses, like to see the things differently and to see the things with a varied perspective. And definitely, to develop a deeper understanding, it is always necessary to have a varied perspective. Now, when it comes to the second aspects, that is the cognitive or the intellectual development. When we talk about the cognitive or intellectual development, somehow it refers to the the processes, because it's a cognitive aspects. It means we are like trying to focus on the processes the children use to gain knowledge, that how the child, how the child is gaining the knowledge, acquiring the knowledge, and getting the things to know, right? And this includes, it may include the language, this also includes the thought, it also includes the reasoning, and it also includes the imagination. So these all are the cognitive or the different aspects of the cognitive and intellectual development. The third thing is like the social and the emotional development. And like they are interrelated. When I talk about the social and emotional development in terms of a child, they're interrelated, that they are often grouped together. Sometimes at some point of time, the psychologists, they just like grouped it together. And the learning to relate to the others is a part of somehow the child's social development, as well as with the emotional development. And it involves the feeling, it also involves the expression of the feelings, like the trust, the fear, the confidence, the pride, friendship, and humor are all the part of one's social emotional development. That when we talk about the trust, it is also the part of the social emotional development. When we talk about the fear, it is also the part of the social and the emotional development. While in journal, like they may be divided, like if we just go with the different perspectives, as I said, that perspectives varies, and it differs like from one perspective to another perspective. And like as per the different perspective, it can be divided into categories for the sake of easier understanding. The physical, cognitive, and the social emotional areas of a child's development, they all are the inflict, they all are linked together. They all are in hand in hand. So development in one areas can strongly influence that in another. Like suppose a child having a very good physical development, so there is a high possibility the it impacted the cognitive development as well. If a child have a very sound cognitive development, it means it might have an impact on the the psychological development or the social development or the emotional development. So that's like they're intertwined with each other. So one development have an impact definitely on the another development. So like in addition to the different areas of development, there are so many studies which we quoted during our session and during our discussion in this course. There are the different studies which shown that the development follows a sort of key patterns. Like there are the key patterns in the principles which we discussed. We talked about 10 principles of development, and there is a particular pattern in it, that how this the development goes from general to specific, and like the cephalocaudal, and although they're like different, like how the development is spiral, like what is the direction of all these things. So there are some important 10 principles which we talked in one of our session. And of course, understanding these principles, not only for the exam perspective, rather to understand these principles by keeping the child in our view, by visualizing the child, it has a great influence on how we care for, treat, and somehow understand the children today. So what I want by all of you, like you have the PPTs, you have the live sessions, recorded sessions. I want you all to go through the session of the development of the principles, right? Principles of the growth and development again, refer it again. And now how we have to read it? We have to read those principles by keeping the child at the center, by keeping the child in our mind, and then try to, reread it again. Because if we will not be able to relate these principles with the child growth, we will never be able to see that how actually we have to understand a child, how actually we have to visualize that growth of the child, how actually we have to treat a child somehow. Right. So the behavior challenges are the most common reason that why the people usually go to the doctor. Like there are like the behavioral issue, there are like the which impacted sometimes the physical growth and the physical health of the child as well. So we need to refer that video again. That is my request to all of you. Now, let's come to the one important aspect of today's discussion, that is the milestone, the second aspect, right? Milestone is like that, it's a very important second video of the on the milestones, and the developmental milestones is no doubt very important. It's a very important way for the psychologist, and especially the practitioners, the psychiatrists as well, the doctors as well, to measure the child's progress. When I said milestone, it means these are the majors, to see the child's progress in several key development areas. The act as in a checkpoints, the act as in a checkpoints in a child's development to determine what the average child is able to do, like what an average child is able to do at a particular age, right? And knowing the milestone for the different ages, because at the different age the physical development is different, at the different age the mental development of the child varies, the social development of the child varies, the emotional development of the child varies. So with the help of those milestones, it helps the child psychologist, it helps the Ayurvedic practitioner as well to understand the normal child development, and aids in identifying the what are the potential problems, like which somehow they delayed the development. If I said that the child is not normal in terms of any aspect, means any aspect rather, physical, the emotional, the cognitive, the social, and so on, then it means what I need to refer those milestones. And when I'm talking about the milestone, it means what? It means what? That sometimes, like what happened, like some children, it's like it's visible as well. Like a child, for example, a child who is 12 months old can typically stand, right, and support his or her weight by holding on to something. It's very much visible to all of us. But some children at this age, at the age of 12 months, can even walk, right? Some children can't even stand properly, but some children can walk. And if a child reaches 18 months of age but still cannot walk, then it is actually the worrisome situation. Then it might indicate a problem that needs further investigation, right? So that is the thing where we need to refer those milestones. And especially being an Ayurveda practitioners, like there was a special focus on the trigun and the tridosh, and there we talked about the the vat, pit, and kapha. We just talked about all these things in a very detailed manner. We also talked about that how this like rajogun, that sattvic gun and the tamasic guns, they impacted the individuals as in terms of the growth and development, and they are the important milestones. And a part of those, there are the certain milestones like the physical milestones, there are the mental milestones, the emotional milestones, the communication and the language milestones are also there. And as I shared, the trigun and tridosh, so they are the 5 major milestones which we discussed in our sessions. And especially like what I want you, after going through that video, what we can do, we can even develop a sort of a checklist, like the best way to study this courses with the lens of and especially with the lens of milestone, that what we can do, we can develop a checklist of the development milestones, and then try to look at child's development with the perspective of those milestones. And it gives us like a better viewpoint, it gives us a new perspective, it gives us the overall idea of looking at child. Now let's come to the third the third important aspect, that is the behavior. Like it's very important. We just can't put all the children under the one ambit, that is they're not behaving properly, because all child can be can't be naughty, all child can be the impulsive. There's a variation in the behavior from time to time. Sometimes we do believe the child is very naughty, sometimes we found that child is very introvert, sometimes we found the child is very extrovert and like very impulsive. So it varies from time to time, and especially the conflicts between the parents and the children are inevitable as the child struggle like from the terrible twos like through adolescence. And there we talked about adolescent in detail, and we also consider it as a stage of stress and storm, because that was a time like when the child passes through the adolescent, then the child assert their independence, and the child asserts their independence and develop. They try to develop. They were very assertive and also trying to develop their own identity. They are in the process of identity formation. So these behaviors are a normal part of growing up processes, but we need to see a lens. We need to see a lens of child psychology. We need to see a lens of the fundamentals of child psychology to see that okay, everything is normal. It's very much normal when a child passes through these stages. Then these things are, and these behavioral aspects are normal, and like they're supposed to behave like this. So, however, that the some children have extremely difficulty with challenging behaviors that are outside the norm for their age. They found it difficult, they found it struggling, they found a sort of a conflict. And in fact, like we say, that the behavioral issues are the most common reasons that somehow the parents seek the help of the doctors, and especially the child specialist, which involves the looking at the all possible roots of the behavioral issues, that why it is happening. And when I said that all possible behavioral issue, it means it also include the brain disorders, it also include the genetics, it also include the diet of a child, like and in one of the session we talked in a detailed manner the diet, what diet should be given to the child at which particular age, and especially the family dynamics and stress, and then treating them accordingly. So being in a the child specialist, or being in a person of the Ayurvedic practitioners, we should be thorough and we should be well versed with all these things, and we already studied it in a detailed manner in one of our session. And alternatively, like we can say that the behavioral issue, it also involves a pattern of sustained hostile, or we can say the aggressive or the disruptive behaviors that are not appropriate for the child's age. So and there are some sort of very typical behavior, ADHD nowadays, it's very like common when we said that it is an attention deficit hyperactive disorder, and it's very common in the children nowadays. And like they have some sort of common system, like common sort of symptoms as well, which we can, which we discussed with the emotional problem and the mood disorder in one of the session. I guess in second last session, we talked about these disorder, where we talk about the anxiety, where we talk about some sort of, that adolescent issues. There we talked about these disorders as well. Now, let's come to the fourth aspects, that is the emotions. Emotions is very important and central to all of things. And when we said the emotional development somehow we can say that it involves the learning, and what we need to learn involves the learning that what feelings and emotions are. That's what the emotions are. Emotion is not about like if I said I'm happy, if somebody's crying. No, rather when I said emotionally developed, it means that I know that what the feelings are, I know what the emotion are. I should have an understanding of the emotions and feelings, and understanding especially that how and why they happen, because it's not that you are feeling sad unnecessarily. So if I said the understanding, like how the emotions and the feelings are developing and why they are happening, as well as the recognizing one's own feelings and those of others, and developing the effective ways of managing them as a part of emotions. So it's not only about recognizing the emotions, rather that like we also need to understand that how it is happening, the why they are happening, and how to recognize especially that our own feeling and those of others, and somehow and also to develop the effective ways of managing them. So we should have an understanding and also have some ways that how we are going to manage those emotions, because it's a very challenging and this complex process We can't say that it begins in adolescent, it begins after 21 or 22. No, this complex process begins in infancy, as when the child was infant, and continues till adulthood. Like, it's not a kind of thing which we can segregate it in terms of stages. Okay, now the child is infancy, adolescence, like childhood, adulthood. No, rather it is a kind of a process which goes on, like starts at the infancy and continues into adulthood. And the first emotions that can be recognized in babies, especially when the child is an infant, it includes the joy, the anger, the sadness, and fear. And later on, the child develop a sense of self. Okay, now it's me. Now I'm a female. Now it's me. It's belongingness, the attachment, and the more complex emotions like the shyness, the surprise, the shame, guilt, pride, and these all are emotions also came in. So like we also learned that how we can regulate these emotions in more difficult how we how to regulate the emotions, though it is very difficult for some children than it is for others. So we need to develop, and we developed rather with the help of this course, that understanding as well, that how to regulate the emotions. And this may be sometimes especially this may be due to the particular emotional temperament, because some children simply feel that emotions more intentionally and intense. The intensity of the emotion is high in some children in comparison to other children, and easily, I mean, they just get hurt easily, right? Like, suppose a child is sitting with somebody else, and someone and the child is asking for a pencil or a pen, and the fellow friend is not offering that pencil. Also, sometimes the child get hurt. So it varies from individual to individual, and they tend to be more emotionally reactive and find it harder to calm down. So there also, we as an individual, even being in a part of a society, somehow need to learn that how, or whether rather we learned it through this, that how to understand the emotion and how to tame those emotions. And we also, because studied some of the strategies which help us to learn to to accept the feelings, and which help us to learn that how to make the individual accepted towards their feelings, and how to make the child understand the link between their feeling and behavior. Now let's come to the fifth very important aspect, that is a socialization. That socialization is a very important area which we covered in it, and especially when we talk about socialization, it is closely related to the emotional development, and that is the social development. Socialization is a part of social development. And when we talk about socialization, it involves that acquiring the values. Not only values, it also involves acquiring the knowledge and a skill. It's a triangle, like value, knowledge, and skill. And acquiring all these three things, it involves the part of socialization. We can't acquire the values without getting socialized. We can't acquire the knowledge as well without getting socialized. And also the skills we need to acquire by the process of socialization. And it also enables the children, it enables a child to relate to other effectively and to contribute in a positive way to the society. While this is a continuous process, like socialization is not a kind of a process which we said, okay, like now you are 5 years old, now the process of socialization it stops. No, it's not that. So we can't say we can't say that this is a stage to be get socialized and now further there will be no socialization. No, it's a continuous process. It's a continuous, ongoing, lifelong process. And early childhood is a crucial period for the socialization. And that was the time where we discussed about the Sola Sanskar. And especially because that the relationship between the socialization and sanskar is closely intertwined. We just can't separate these two things. Like socialization refers to the process through which individuals acquire the knowledge, acquire the skills, acquire attitude, and the necessary values which enable the child to function effectively in the society. It also involves, when we talk about Sola Sanskar, it involves the learning social norms, because every society has its own norms, learning the social behaviors and the cultural practices that are prevalent in a particular community or a group. like especially when we talk, because here we are talking about the sanskar. So when we just look at it, like especially the term sanskar, it is a concept in our Indian culture and philosophy, right? And it also have the wide range of rituals and practices, since from garbhadhan till antyeshti sanskar. Like they have like it's a wide range of rituals, they have a wide range of practices, and even everything is fixed, that when we are when we are going to take our child out for the first that sunshine, and when we are going to give our child the first that eat. So everything is there, the rituals are decided, the practices are decided already, that predetermined in terms of sanskars and the teaching. And these all things somehow the shapes the individual character, it also shapes the individual behaviors, and it also shapes the individual with a highly valued moral attitude. So sanskars are considered to be, we can say, some sort of like transformative experience that leave sort of an impression on person's psyche and guide their actions and thoughts, and that makes the very important unit of this course. So, and when what I want now, that while exploring the relationship between socialization and sanskar, definitely we consider, and you all might have find that the socialization has an important role in imparting sanskar. Without socialization, it is also not going to be get imparted very effectively. So as individuals interact with their social environment, they absorb, right? They interact first, then they absorb, and then internalize. What they internalize? They internalize the values, they internalize the beliefs, they internalize the customs, they internalize the practices that are prevalent in their society, and that also influence, and these social this they shape their sanskar. And like as they learn what is considered appropriate, which they consider the moral, ethical, and within their on the cultural framework. So like especially now I just want, like, let's come to our next important aspect after completing these the major areas which we covered in our syllabus. I just want us to focus on the major context in the children's psychology, because there are the three major contexts, and around these contexts actually the whole units revolves around, right? And especially to get into it, I just want that like if we as in a commoner, like we are not the Ayurveda practitioners, we are not in the medical field, as in a common people, we all probably think about the internal factors that somehow influence that how a child grows. Like we consider that, okay, genetics and personal characteristics are very much important for the individual growth, right? Like however, the development involves much more than the influences that arise from within an individual. No doubt the genetics plays an important role, the personal characteristics plays an important role, but there are the context as well, which we consider or which are very much important and considered important for the child psychology. Like these are the cultural context, the social context, and in a socio-economic context. And as we discussed, like that the cultural context is all about that, how the child lives in or contribute a set of values, customs, the shared assumptions, and the ways of a living in everything through a lifespan. And when we talk about the social context, it's all about the relationship with the peers, the adults, the family members. What happened with that relationship? It impacted that how the child think. That relationship impacted that how the child learn and how the child develop. And if we want to understand the pattern of thinking of a child, the pattern of learning of a child, and the pattern of the development of the child, then for that, what we need to understand, we need to understand deeply about the social context of the child. Also, when it comes to the socio-economic context, the third one, like the social class, it also plays a major role in child development. And socio-economic status, it is something like which includes like how to like how much education one can get, how much money they can earn, the job they hold, and where they live in. And it also impacted the child, the psychology, or we can say the child's development in the varied aspect. Now let's come to let's come to the one very important aspect, that how to understand somehow the fundamentals of child psychology, how to understand this course, especially when like we are working on this course. Like I strongly believe that Child is no doubt is very crucial for their physical or early years, especially the early years of the child. Early years in the sense like the beginning time of the child. That's very crucial for the physical development, emotional, and the social well-being, right? And we all must agree. But all these accords to their brain development and their personality development. And understanding the children's psychology is not easy. I'm telling you, it's a very difficult. Try to. That's why I'm asking that whenever you will go with the sessions, will you go with the recorded session? In every recorded session, there is a scope for some sort of activities, some sort of observation. So what you need to do while going through those sessions, that's what I'm telling you, that how we are going to relook again in these recorded lessons. So what I want, like, because it is not in a very easy way to understand the child psychology, it's very challenging. So like, if even for everybody, even for the parents, it's not easy. So now what, and especially the, the accepting the child's quality, their wants, their needs is a key to become a good practitioner, right? If you understand, like, okay, which kind of a traits the child is having, what is the requirement of the child, so it means we are the good practitioner. And like, because when we were interacting with the child, they get a sense of a security when you accept them just the way they are. Okay, I'm a notorious child, for example, I'm interacting with my doctor, and like my doctor is accepting, somehow having a sort of an acceptance with my notorious quality, then then it gives me a sense of security. Okay, now I'm accepted, I'm safe here, and that gives the confidence. Now I'm sharing you the few tips to relook these videos, that how you have to relook, and how we all have to understand the child psychology. There is a three important tools, right? Observe, appreciate, and listen. So what you need to do from the session 1 till end, like wherever there's a scope of activity, and whenever you are going to read it or listen it, so what we have to do, we have to use these three tools. That one is observe, we need to appreciate the child, we need to listen. So we need to keep these things at the central, and these are the simplest tool which we can use in learning the child psychology. And by observing the child while the child play, asking for the thing, or reacting to the certain situation, we get to know a great deal about his overall personality. I'm telling you, we need not to put any efforts, we just need to observe the child behavior, and we get to know that actually how the child's personality is shaping. Appreciation, the second most important asset. Just praise a child for the work done, right? Good work, it boosts the self-esteem, it really works. However, I here want to grab your attention, that over praising them can make them arrogant. But when you appreciate them for their work, their acceptance or arrogance will help you understand what actually they are accepting from you. So by keeping the lens of appreciation, we again need to relook at these videos. Third thing, listen. By listening to what a child has to say, you get to know them better. Just listen, just listen. They just come up with so many stories here, there, but we need to listen. Doing so well, make them feel that you are interested in their life. And this will in turn help to strengthen the bond between you two, and they will take a step further or forward in listening to what you have to say. It will help them to, to develop in a positive manner, in a very qualitative manner. Now, here is a time that actually in this new era, we as a Ayurvedic practitioner, I just want to say, because it gives me a sort of a very joy today, as we all are here, like and we are somehow like focusing on a sort of we are moving towards the completion of our child psychology course, and it itself is in a very significant milestone in our journey as a practitioners, as we embrace a new era of change and transformation. And we all can do, because we are the first year student, and like it is the first time like we are going with these sort of courses. So today I must say that we are, witnessing a profound shift. There is a shift. It is a paradigm revolution within the noble profession. It's a very noble profession. And Ayurveda, with its holistic approach to healthcare, has long been revered for its wisdom and effectiveness in promoting well-being. And now, we stand on a threshold of a new frontier, like Ayurveda practitioner, like turning into researchers. Like with the help of those three tools which I shared, we need to observe, we need to appreciate, we need to listen. And these are the three tools, and we can turn up into researcher with a specific focus on child psychology. Very interestingly, actually, in this rapid evolving world where the mental health issues among children have become a pressing concern, not only our country, the complete nation is under the, under the impression of those mental health issues. So it is our responsibility as our Ayurvedic practitioners to adopt, to adapt, to evolve and expand our horizon. We can't, delimit ourselves in a particular realm. We need to expand our horizons. And the unique insight and the ancient wisdom of Ayurveda, like it definitely plays an important role in understanding as well as in addressing the psychological well-being of the youngest generation. Because our youngest generation, the one who is at the adolescent, the one who is at the infancy, they are at the youngest level, and it gives a lens to understand them in a better ways as it delves into the field of child psychology, so armed with our Ayurvedic knowledge, so that we can, make our journey remarkable, and we can make this journey as a journey of discovery. Our commitment to research like signifies a sort of commitment to deepen our understanding of the human mind and its intricate connections to the body as well as to the spirit. So now, I guess, after going through this course, we have the opportunity to bridge the gap between the traditional healing practices, because there are so many traditional healing practices, right? And there are the modern scientific method. But this way, we can bridge this gap. What was the traditional? What are the modern practices? And we can create a synergy somehow that will enhance the lives of the countless children. And in this new era, we must approach the child psychology with open minds, the humility, and an unstable thirst for the knowledge. So we must embrace the evidence-based research, the rigorous methodologies, and the collaborative efforts that bring together, experts from the various disciplines. And I just want to say, somehow at the end that as we are like stepping into this like after going through this course, so we all need to be the torch bearer of the knowledge, the compassion and the healing. And like I just want to congratulate as well to all of you, because like we are in the phase where we're supposed to complete this course. And for the assessment as well, because I like the assessment portion of this Ayurveda course there is, so I just want you to do two things. The first thing is there are the activities in between. While going through those activity, I just want you to do the peer assessment. I want that where there is a group task or the individual task, just go with those tasks, because the only thing which you have to do, you have to observe the child, you have to listen to them. We just have to sharpen our skills while going through those activity, and go with the peer assessment and ask your fellow friend, can you please, mark me, grade me, or do whatever you just feel right. So in that way, it helps us to understand the word of a child in a better ways. And the second thing, there are the objectification, and that I know that you must have done by that time. So thank you so much for this discussion. Namaskar, dhanyavad.
नमस्ते बेटा।
Namaste.
कैसे बच्चे?